Welcome back to Body Beautiful. Right now we're talking about breast augmentations and lifts. And first, let me remind you that we'll be taking your calls live on the air. That number, 800-440-4884. We'll also be posting the number for the doctor's office during and at the end of the segment. And our caveat, any advice we give you today, you'll also want to consult your own physician as well. Doctor, we had a caller. She was a little bit shy about actually going on the air.
Sure.
She had a question about, she went out of the country to have a breast augmentation, and one of the breasts deflated. Her question is, she wants to know how long she has to wait before fixing the deflation.
It can be fixed at any time. There's an advantage to fixing it sooner than later, because if an implant is deflated, the scar around the implant will start to shrink. And if we wait too long, that scar will then be too small for the implant. We have to actually open it up again, which is not a big deal, but it takes a little longer to recover.
Okay.
But if things look good before and there's a deflation and we get in there quickly and just replace it, they look good again afterwards. And the recovery is really quick for replacements.
Yeah. I guess I'm just wondering if she thinks that the body has to heal or something, but it's not even, nothing like that is involved.
If it's a saline implant, the saline leaks out. We're mostly saline, so when we have a saline implant that leaks, it's like we drank some extra water. The water just goes away. And then what's left is the shell. So what I do is I go in there, just take out the shell, put a new implant that doesn't have a hole, and fill it back up.
Okay. We had another caller. We've had some men call.
Yes.
And I wonder, do a lot of husbands or boyfriends, are they really behind this push to
I really like it when a woman comes in with her husband or boyfriend. To me, that means, you know, they're serious about doing it, they're thinking about it, they're sharing the experience, they're not trying to just sort of sneak off and do something. They're being open about it, and I think it makes it easier, because if you can discuss it with people around you, you'll get their feedback. You may not want to hear all of it, but at least you know what the pros and cons are. So I like it when people come in with, even with their friends, or you know, if it's another woman that comes in, that helps too, because they'll think of other questions.
So is the driving force to maybe look better in a bathing suit or a dress with a plunging neckline, or is it just more that body image of, you know, with just you in front of the mirror?
I would say the vast majority of my patients are doing it for themselves, to feel better about their body, better how the clothes fit, how they look. It just makes them less self-conscious. And you know, we like to worry about stuff. So if I can get rid of something that someone's worrying about, they'll find something else to worry about, but they'll be happy.
Okay.
It's a nice thing.
Well, you know, I mean, are there different events in life that might necessitate a breast augmentation or a lift? And we talked about childbirth.
Sure. The most common reasons are just never had the breasts that they wanted. Always had a small size, and it works for breast reductions too. Always had a large size, just not comfortable with the size of the breast. The other things that happen as we go along in life, pregnancy certainly can cause changes, and weight gain and then weight loss. The weight loss tends to deflate the breast. It's a place where we tend to put weight quickly and lose it quickly.
I mean, and we addressed this too about pregnancy and what it does to the body. Do you have people that come in and say, look, as long as you're at it, you know, maybe you can lift and do a tummy tuck? I mean, is that
very
a common
to combine with tummy tucks or liposuction? Those are also some of the more common procedures we do. But when having babies, when being pregnant, it kind of hurts both those areas. And the tummy gets stretched from the pregnancy, and the breast gets stretched from the lactation.
And again, I think we probably need to point this out, that if you are planning to have more children, probably is a good idea to wait until you're done.
It is, and more so I think for the tummy tuck, because with the tummy tuck, part of the procedure is tightening up the muscles. And that may be tight. If we make it too tight, it may be harder for the muscle to stretch with a second pregnancy.
You know, we don't really often talk about this because breast augmentations are so popular, but you did mention breast reduction.
Yes.
Gosh, in this culture and day and age when everybody thinks bigger is better, do you really have people coming in asking for less?
Yes. Despite some of the enormous implants you see out there, there are folks born with large breasts who have neck pain, back pain. They'll develop a rash under their breast during the summer months because it's skin on skin. And they are some of my happiest patients because I'm getting rid of pain for them. Okay,
and for someone who wants to undergo that procedure, talk to me in terms of the downtime and the length of the actual surgery itself.
Sure. The surgery takes longer than a lift, but it's very similar to the lifts that we do. And because of that, the recovery is easier for reductions than for augmentation, because we're not really having to go behind the muscle, we're just in front of the muscle. It's still sore. I find women who have very tender breasts with menstruation tend to be a little more uncomfortable after the surgery, especially during that first menstrual cycle, but the recovery tends to be pretty quick.
Okay. Have you ever had somebody who's undergone the breast reduction and then comes back later and says, you know, maybe I need to bump up a size, maybe I want to go
I can't say it's never happened.
Wow.
Yeah, it's unusual though. Most of the people who want reductions want to be small.
Okay.
And most people who want to be larger want to be larger.
We need to take a quick break, but for more information about Dr. Mele, you can call him at 925-943-6353 or check him out on the web at both drmele.com and also San Francisco Plastic Surgery blog.com. There's also a version of his website in Spanish at cirugíaplastica.sanfrancisco.com. And when we come back on Body Beautiful, we'll continue talking about breasts and also take some of these phone calls that are rolling in.